Hey everybody, and welcome back to EMT training. I'm Gabby Reed, one of the ResTopios, and today we're going to be talking about splinting. So, what is splinting? Splinting is a temporary immobilization of a part of the body that has undergone a traumatic injury. It prevents further injury and also provides some pain relief for your patient. So, when should I splint an injury? Some indications for splinting include closed fracture, sprain, dislocation, strain, or rupture of tendons. Do not splint injury if it's an open fracture, compartment syndrome, or neurovascular compromise. Here's some types of immobilization devices. You've got the board splints, SAM splints, traction splint, and the C-collar. How to use the board splints. So before splinting any injury, you're always going to check for circulatory, motor, and sensory skills. So if your injury is to the arm, you'll check for a radial pulse and then ask them to wiggle their fingers and then touch one of their fingers and ask them if they can feel it. Next, you'll stage the triangle bandages and apply the board splints with the soft side touching the patient. Then secure the boards by tying the triangle bandages around them with the knots touching the hard side of the board. Then you're going to check for CMS again in the same way that you did earlier. How to use the SAM splints. Again, same first step, check for CMS. So these splints are pliable, so use one of the patient's uninjured mirroring appendages to mold the SAM splint to the shape that you want it. So if they broke their finger, you'll use an uninjured finger to mold the shape of the SAM splint. Then apply the SAM splint to the injured appendage and secure it with triangle bandages if you need to. Finally, you're going to check for CMS again. You can only use a traction splint on a closed femur fracture. So before you use the traction splint, consider the location of your injury and the type of injury. Make sure that it is not affecting the knee, the hip, the lower leg, or the ankle, and that the leg has not been amputated or partially amputated. How to use the traction splint. First, have someone apply manual traction to the injured leg, so that'll be just slightly pulling on the leg. Check circulatory, motor, and sensory. The pulse can be felt on the top of the foot. Then apply the ankle hitch and use the uninjured leg to adjust the length of the traction splint. Then slide the traction splint under the patient with this part that I'm pointing to right at the very top of the leg. Once the traction splint is under the patient, you can hook the ankle hitch into the traction splint and apply mechanical traction by just turning the knob at the very end. Once you've applied mechanical traction, secure the leg to the traction splint by closing these straps over the leg. Then you're going to check for CMS again. How to use the C-collar. So first, you're going to have someone stabilize the head and the neck. Then use your fingers to measure how long the person's neck is. This can be measured from the top of the trap to the bottom of the jaw. Then open the C-collar and unlock it from the back. Once you've got it unlocked, you can adjust how long the C-collar is. There's typically 4 settings: no neck, short neck, long neck, and very long neck. Once you've got the C-collar locked in place, apply it by putting the chin in the chin rest and wrapping the back around the neck and securing it on the side. Once you've got the C-collar on the person, make sure that it's secure and do not remove or adjust it. So that's all I've got on splinting. If you guys have any questions, feel free to reach out.